Hi, my name is Yasmin, and I'm here to speak about interventions of problematic pornography use in adolescents. So as we know, studies found that the higher use of pornographic materials is usually associated with increased difficulties in intimate relationships, as well as it does play a factor in academic and professional functioning. There is a significant amount of subjective distress, and there is an increase in sexual compulsivity. So with that being said, what are some of the interventions that are being used or have been used for problematic pornography addiction? We're first going to go ahead and look at some of the psychosocial interventions that have been used. Despite the research or the growth in research of problematic pornography use, the research is still very sparse. With that being said, one of the interventions that's used is called acceptance and commitment therapy. Now, to date, only one experimental treatment trial of pornography use has been conducted, and this was conducted back in 2010. The researchers used acceptance and commitment therapy, which is a third wave cognitive behavioral process-based intervention that targets inner experiences, for example, such as feelings, thoughts, and bodily sensations, and uses behavior change strategies. So what the researchers proposed was that viewing can be triggered by various events and includes persistent thoughts and urges to view that are regulated through the act itself. So conceptualizing like problematic pornography use as an OCD spectrum disorder, the authors stated that viewing is mediated by the effort one exerts by struggling and attempting to control the urges to view pornography. So as such, treatment targets acceptance of urges versus fighting the urges, and helps people break the cycle between experiencing and urge needing to act on that urge. So, but one of the limitations that they found to this study, other than that it was a small sample size, is the degree to which acceptance-based therapeutic techniques, above and beyond behavioral techniques, resulted in positive treatment gains. Okay. The second thing that can be used as an intervention is cognitive behavioral therapy. Okay. Now, in the same research, they reported data on a 23-year-old white male who presented to treatment for help reducing his daily pornography use. Now, the therapist did not apply a specific disorder framework to the conceptualization of this case, but instead a functional analysis of the client's pornography use guided treatment intervention. Treatment was cognitive behavioral in nature. After the initial clinical interview, the client attended 9 treatment sessions over a period of 3 months. The treatment protocol consisted of several components. One of them was psychoeducation, identifying triggers of use, challenging cognitive distortions that served as triggers for use, seeking alternative activities, and controlling the environment by reducing tempting materials or stimuli. So, furthermore, what they found was that the client and therapist generated a list of alternative pleasurable activities other than viewing pornography in which the client could engage, such as spending time with friends and cooking, all which have elements of positive psychology. The client successfully reduced his problematic pornography use to viewing at a level that no longer interfered with his self-worth and ability to form and engage in an intimate relationship. So, because abstinence for this particular subject was never the therapeutic goal. So during the course of the therapy, the client was successful at abstaining from viewing pornography for 45 days, although he viewed pictures of underwear models on occasion during this period. Shortly after the treatment ended, the client reported that he viewed pornography once in a 60-day period and decreased his underwear model viewing to approximately 15 minutes per week. Even though the study was limited to a single case study, and it did not include a baseline assessment period, and it did not employ a long-term follow-up period. So that was, I believe, a weakness of the actual study. Okay. They're continuing treatment development and initial piloting of the cognitive behavioral therapy for use of this. Actually, there was a study done in 2012 by Bridges and Minarsik, and they developed and piloted a cognitive behavioral treatment for pornography use. And the treatment approaches problematic pornography use as an impulse control disorder, similar to pathological gambling and a restriction of one's behaviors for coping. In the initial stages, pornography's use is seen as a behavior that is positively reinforced, while later use may also be negatively reinforced, i.e., motivated by escaping negative emotions or tension. The treatment, as originally designed, includes components that are designed to do the following. Number one, it enhances motivation and readiness to change, okay? Number two, it provided psychoeducation regarding why and how pornography use becomes problematic from a biopsychosocial perspective. Number three, it utilizes behavioral strategies to manage the contextual factors that trigger pornography use. And number four, it utilizes cognitive strategies to manage the negative self-talk that triggers pornography use. Number five was it used relationships enhancement techniques to improve the primary romance relationship if applicable. And the last was, which is number six, it provided instruction in relapse prevention. In the initial treatment development and pilot testing of this particular step, a total of 10 male participants who had responded to internet advertisements for free treatment of pornography addiction were recruited into the study. Participants were randomly assigned to 3 months wait list or to begin treatment right away. While a broad outline of this treatment components was developed, the number of sessions, which averaged around 8 sessions, the duration of components varied by the participants based upon their specific presentation. Some of the primary measures included looking at the perceived psychological and spiritual outcomes from sexual behaviors, sexual compulsivity, hypersexual behavior, and sexual functioning, quality of life, and relationship satisfaction. There was a number of improvements across those domains for the participants who completed the treatment protocol. Reliable changes were computed, and some of the results were that 67% of the participants reliably reduced negative psychological and spiritual outcomes from sexual behaviors. 50% reliably reduced sexual compulsivity symptoms, and 50% reliably reduced their hypersexual behavior. Improvements were also noted for sexual functioning, quality of life, and relationship satisfaction. But these did not meet the criteria for a reliable change. So, importantly, no reliable changes were noted in these arenas during this three-month pre-treatment wait period. A critical limitation to the study, beyond its small sample size, is that the treatment protocol was being actively modified during the pilot testing phase. So, for instance, the initial protocol did not include a review of the stages of change in the earlier sessions. Instead, it was limited to the last few sessions focusing on relapse prevention. However, the clinicians involved in this study determined it would be beneficial to cover this prior to the client experiencing a lapse while in treatment. Therefore, it was added to the psychoeducation component of treatment. Because of these sorts of active modifications in treatment, the extent to which the final treatment is efficacious remains unknown, okay? So these are certain interventions that we can go ahead and apply to adolescents who are addicted to pornography.